Okay. So as you guys already know, when it comes to part C of your reading, you get eight questions for each extract. There are 2 extracts, and you get 8 questions for each extract, which means 16 questions. The best way to approach it is somewhat similar to part B. You read your question, you interpret it. Okay, if it's a complete question, you focus on the question word and interpret the meaning. And when it comes to an incomplete question, you look at the words look at the words towards the end and try to understand the question. Okay, all right. So then you go through your respective text, understand the meaning, then you choose the most appropriate option as your answer. Okay, so let's dive into it. So today's material is paragraphs are pretty small, only 1 or 2 paragraphs are pretty detailed. However, there are questions where you might feel the options are very same or what to choose, okay, because the answer is in the details. Okay, so let's dive into it. So let's start with the first question. Okay, all right, 1 second. Yeah, Srividya, would you mind unmuting yourself and reading the first question for me, please? Yes.
The writer suggests that restless leg syndrome.
The writer suggests that, okay, so I've told you before, when after suggests, after conveys, after, all those verbs establishes that, when it comes like, when that comes after such verbs, that means about. Okay, so now all of you take a second, go through the question. Tell me, what do we need to find out here? The writer suggests about restless leg syndrome. So we need to figure out what is the Srividya, Anu, Atulya, Lichi, Judy, Preeta, Manisha, 1 second, Vinita, Atira, Tina, Dali, others, the sessions for this to work, Triveni as well. For the sessions to work, I need your participation. I know you might be, working. Those who are working, I completely get it. Those who are not working, those who are able to focus, please focus and please make your presence known in the class, because without your participation, since it's part C, it's a very dry subject. I need your help for me to get through the session. Okay, thank you so much. So let's continue. So what is the writer? Give me the remaining part. What is the writer? Yes. Suggest about restless leg syndrome. Okay, so the writer suggests something about restless leg syndrome among these options. So we need to figure out, read the paragraph and figure out among these what exactly is suggested about restless leg syndrome. Okay, all of you get ready. You have 55 seconds. Go through the heading and the first paragraph. Yes, all of you.
Restless leg syndrome.
Okay, Srividya, can you read till here for me, please? Till here. Yes.
The relatively
heading.
Restless leg syndrome, the relatively common neurologic movement disorder known as restless leg syndrome, is poorly understood. Patients describe uncomfortable sensation in their leg that often are worse at night, having a huge impact on their ability to sleep and overall quality of life.
So take a second. So they say that the text is all about the restless leg syndrome. They say that the relatively common, the comparatively common neurological movement disorder. So compared to other disorder, this is pretty common. This disorder is known as, it's a neurological movement disorder, which is very common compared to other disorders, and it is known as restless leg syndrome. And writer says that it is poorly understood. It's not correctly understood by, it's not clearly, we don't know a lot of things about it, or it's not clearly understood. Patients describe, the patients of restless leg syndrome, they describe uncomfortable sensations in their legs that often are worse at night. So patients with the condition experience uncomfortable feelings in their legs, which becomes often worse at night, and having a huge impact on their ability to sleep and overall quality of life. So these sensations become worse at night, and it has a huge effect over their sleep and the quality of their life. Now till the end, please.
Experts now speculate that patients with the restless leg syndrome, like those with unrelieved chronic pain, might feel hopeless, leading to suicidal thoughts and actions. The risk correlates with the history of depression and is dependent on the severity of restless leg syndrome and demographic factors.
Okay, demographic factors. Always remember whenever you get the word demographic, it refers to people. Okay, people. Okay, all right. So let me explain. Experts now theorize. So experts now speculate, means they theorize that patients who have restless leg syndrome, like people who have unrelieved chronic pain, such people might feel hopeless. They may feel that there is no hope. That leads them to have suicidal thoughts and actions. All of you go through it. So according to experts, patients who have restless leg syndrome, like people who, such as people with unrelieved chronic pain, may feel hopeless, which makes them have suicidal thoughts and have suicidal actions. Then they say that the risk. What risk? They've said the risk. So whenever they say the risk, they've already talked about the risk. What risk are they talking about? The risk.
Suicide.
Yes, the risk of might. See, how did I say might? See, whenever you say possibility of something, so that is a risk, right? So might feel hopeless, leading to suicidal thoughts and action. That risk correlates with, mutually connects with, that corresponds with, that matches with, that is consistent with history of depression. So they said, wait a second, they said people who have RLS, they may feel hopeless, suicidal thoughts and suicidal action. And the next sentence I just say that risk, that particular risk of feeling like that is matching with, is consistent with, correlates well with, has mutual connections, corresponds with, matches with, consistent with history of depression. And the risk is, again, the risk is a subject. It is independent of, not dependent. Take a second. Independent of, is not dependent on the severity of restless leg syndrome. The risk of feeling hopeless and suicidal thoughts, is not dependent on how severe the condition is, and is not dependent on demographic factors. It does not affect what type of people, the people related factors. It does not affect that. Okay, so there is a risk. So once again, all of you go through it. So they told that this is a common neurological disorder, and it is poorly understood. Patients who have the condition describe that they have uncomfortable feelings in their legs, which are often worse at night, and that has a huge impact on their ability to sleep and overall quality of life. According to the experts, people with RLS who have unrelieved chronic pain may feel hopeless. So that is a risk. That is a possibility, a problem that might happen. So that is a risk. Hopeless, leading them to have suicidal thoughts and actions. And that risk is consistent with history of depression. So RLS people having these thoughts is consistent, is related to having depression. And that risk is not dependent on how severe the condition. So irrespective of the severity, people are at risk of getting suicidal thoughts. And so it is not dependent on the severity of the condition, and it is not dependent on people, the type of people. So anybody can get it, basically. Are you guys clear? Each, and so we have vocabulary, can correlate. So the risk. So you will be like, what risk are they talking about? So look at the previous sentence. They did not say this risk, they just said the risk. The risk matches with what risk? They are not talking about risk of the RLS. They are talking about people having RLS and their risk of developing suicidal thoughts and being hopeless. That risk correlates with, consistent with history of depression. That means is consistent with depression. Okay, and the risk is not dependent on, it's not dependent on the, so it doesn't matter how severe the condition is. Anybody can get have the condition. It is not dependent on demographic factors, means people, factors related to people. So what type of people, doesn't matter. Are you guys clear? So anybody can get it, basically. Okay, anybody with any level of severity of the condition can get the risk of being hopeless, leading to suicidal thoughts and action, which matches with depression. Are you guys clear? Shri Vidya, Arthira, Jina, Anu, Manjusha, Princy, Triveni, Vinita, Jali, Shalini, Jesni, Anju, are you clear?
Yes, ma'am.
Okay,
Yes,
and please remember in this one, they said something, they said a possibility in the previous sentence, right? They mentioned a possibility in one sentence. How did they mention a possibility? Might, using might feel, right? Then they said, the second sentence, they said the risk. So that was in the second sentence. So what risk were they referring to? That particular possibility. Okay, that's what that is. When we say somebody is at risk, do they have the condition? No, we are talking about the possibility. So remember this connection. Okay, don't forget about it. This is a really good sentence structure. I want all of you to be aware of it. Okay, when somebody is at risk, they don't have it. There is a possibility. So that's why one sentence they conveyed it as a possibility. Next sentence they called it a risk. Okay, all right. So keeping all this in mind, let's go to the questions. Okay, Shivika, can you read each question with the options for me, please?
The writer suggests that restless leg syndrome is impossible to
Cure. Okay, be very careful. It's cure in your speaking as well. Cure. So can I ask you guys something? Did the writer say that it's impossible to cure Atira? No, Atulya, did they say that? Did we say that? No. Next one.
The writer suggests that restless leg syndrome could lead to depression.
The writer suggests that restless leg syndrome may lead to depression.
No, it is
Can this be the answer? Maybe, right? They said, one second, remember, they said, I know some of you said no. They said may lead to, may cause hopelessness. Hopeless plus may cause hopelessness plus suicidal thoughts and actions, right? They said that, remember, plus actions. Then they said the risk. What risk? Then they said the risk is consistent with depression, right? The risk is consistent with
Depression.
Consistent with depression. What risk are they talking about? The risk of being hopeless, that is matching with depression. So people who have RLS may cause hopelessness, suicidal thought, the risk of that, and that risk is consistent with depression. What does that mean? RLS is indirectly related to depression. So can be our answer. Atulya, Binsi, can it be your answer? Yes. Okay, let's look at the next one. Okay, I hear you, but let's look at the next two options. Vidya, can you read the other two options?
The writer suggests that restless leg syndrome doesn't occur during the day.
Did the writer say that? No. Worse at night. Worse at night doesn't mean it does not occur during the day. Okay, next one.
The writer suggests that restless leg syndrome may relate to pain management.
They say that it may relate to pain management. No. So what is the answer? B. So that's why I asked you earlier, the risk. What does the risk indirectly? So they said people who have RLS can have these risks. They are at risk of this. That possibility next, when they said the same thing, instead of repeating that hopelessness and everything, they said they called this as the risk. And that matches with depression. So what does it mean? RLS can cause depression. Did you guys get it? Are you clear? People who said no especially. I understand why you were confused, but take a second. Triveni, are you clear? Princey, are you clear?
Clear, ma'am.
Okay, so we are not imagining it. Okay, one sentence they mentioned a possibility. Next sentence they said that possibility is related to depression. So is matching with depression. So what does that mean? The possibility that connects RLS causes a possibility. That possibility is related to depression means RLS can lead to depression. Okay, all right. Let's move on to the next one. Okay, Atulya, can you read the next question?
Dr. Breen suggests it's important for clinician to treat any suicidal thought because.
Okay, so what do we need to figure out? When you have a question that ends with because, we need to figure out the reason. So why? What do we need to figure out? Why is it? According to Dr.
clinicians to treat.
Why is it important for clinicians to treat? Any
suicidal thoughts.
To treat any suicidal thoughts. Any suicidal thoughts. Okay, according to Dr. Brian Koo. Okay. So why is it important for doctors to treat suicidal thoughts according to Dr. Koo? Okay, let's see. All of you go through the second paragraph. Okay, Atulya, can you read till here for me, please?
Although evaluating restless leg syndrome and finding effective treatment is challenging, a recent study suggests that it is important to assess not only the impact of RLS on the patient's life, but also presence of suicidal thoughts. People with severe RLS are more likely to plan and attempt suicide than people without it, even after controlling for depression, according to new research.
So although evaluating restless leg syndrome and finding effective treatment is challenging, even though you're assessing the condition and finding effective treatment is challenging, although it's difficult to do these, according to a recent study, it's important to assess not only the impact of RLS on patient's life, but also the presence of suicidal thoughts. So they say that it's difficult to evaluate for restless leg syndrome and find effective treatment. It's challenging. Even though that is the case, according to a recent study, it's important to assess not only the effect of RLS, but also the presence of suicidal thoughts. People with severe RLS are more likely to plan and attempt suicide than people without it, even after controlling for depression, according to new research. So, according to new research, even if you control depression, people who have RLS, they are the ones who are more likely to plan and attempt suicide compared to people who don't have RLS. All of you go through it? So evaluating the condition and finding effective treatment is challenging. According to a recent study, it is important to assess not only the effect of RLS on the patient's life, but also the presence of suicidal thoughts. People who have RLS are more likely to plan and attempt suicide compared to people who do not have RLS. Okay, even if you control depression and people have RLS, they are more likely to attempt suicide. Okay, now last entire thing, please. Yeah.
Lifetime suicidal ideation and attempt are very prevalent among people with the restless leg syndrome and seem to be independent of demographic patterns and depression and seem to be associated with the severity of restless legs, said Brian Koo, MD Director of the Yale Center for Restless Leg Syndrome, Yale University, New Haven, Connecticut.
Okay, here it's Yale University. Anyway, let's go. Okay, according to Dr. Brian Koo, who is a director at the Yale University for Restless Leg Syndrome in Connecticut, he says that lifetime suicidal ideation, having suicidal thoughts over a lifetime, and attempting suicide are very common, very prevalent, means very common among people with restless leg syndrome, and seems to be independent of and seems to be not dependent on the demographic type of people and depression, and seems to be associated with the severity of restless leg syndrome. All of you go through that. Independent means not dependent. Okay, so he says that having lifetime suicidal thoughts and attempts are very common among people who have restless leg syndrome, and it is not dependent on the type of people. Demographic factors means factors related to people or the population. That means types of people or depression, and it seems to be associated with how severe the condition is. All of you go through it. So they have said it's very difficult, it's challenging to evaluate the condition and find effective treatment. And according to a recent study, they need to assess the impact of RLS on the patient's life. But at the same time, they should also assess the presence of suicidal thought. And they said people with severe RLS are more likely to plan and attempt suicide compared to people who do not have RLS. Then according to Dr. Brian Koo, lifetime suicide ideation, a lifetime of having suicidal thoughts and attempts are very common among people with RLS. And it is not dependent on what type of people, it's not dependent on depression, but it seems to be associated with how severe their condition is. Are you guys clear? Are you guys clear with the meaning?
Clear.
Okay, so always remember demographic factors means instead of saying type, understand it like this, types of people. Okay, what type of people, it's not dependent on that. Okay. All right. So keeping this in mind, we need to figure out, as suggested by Dr. Brian Koo, why is it important for clinicians to treat any suicidal thoughts? Okay, why? So based on what we have read, we need to figure out why should doctors treat any suicidal thoughts of course, for RLS patients. Okay, so Atulya, can you read each option with the question for me, please?
Dr. Brian Koo suggests it is important for clinicians to treat any suicidal thought because older people are more likely to suffer from RLS.
Anu, others, what do you guys think? Vinita, Anshu, what do you guys think? Can
No,
A
ma'am.
be the answer? No. Have they talked
No.
about older people? No.
No,
No.
ma'am.
Next one, next one.
Dr. Brian Q suggests it is important for clinician to treat any suicidal thought because the effect of RLS can be better identified.
Did they say that they need to treat suicidal thoughts because then the effects of RLS, the impact of RLS can be better identified. They can identify the effects better if they treat suicidal thoughts. Did they say that? No,
No,
not exactly.
ma'am.
Not exactly. Next one.
Dr. Brian Q suggests it is important for clinician to treat any suicidal thought because it makes managing RLS much easier.
What do you guys think? Can this be our answer? Okay.
No,
No,
ma'am.
yes. Let's see. Next one.
Dr. Brian Q suggests it is important for clinician to treat any suicidal thought because RLS is a mental health condition.
Did they say that in that paragraph? Did they
No.
suggest that RLS is a mental health condition?
No.
No,
No.
ma'am.
Okay, so here, I'll tell you one thing. Here, okay, okay, one second. I'll tell you. Answer is C. I'll explain it to you. So here they've asked a question. Okay, they've given what Dr. Koo said. Okay, based on that, they have asked a question. So they've given a question that is not directly given there. Okay, it's not said by him, but it's suggested, it's implied by Dr. Koo. Okay, I'll tell you one thing. Wait a second. I'll tell you. So look at the paragraph. It starts by saying, evaluating for restless leg syndrome and finding treatments is challenging. Okay, it's difficult. And according to a recent study, it's important to assess the impact of RLS and at the same time the presence of suicidal thoughts. So they said that it is important to assess the impact as well as the presence of suicidal thoughts. So after saying all these things, they brought what Dr. Brian Hu said. What did he say? People who have lifetime suicidal thoughts and attempts, lifetime suicidal thoughts and attempts are very common among people with RLS. And those thoughts are not dependent on what type of people or their depression. Rather, it's dependent on, it's related to the severity of restless leg syndrome. So now read these and read. So read from here till here, and then just go through till here. Go through this. All of you. Take a second. Said it's challenging to treat and evaluate the condition, and it's according to a recent study, it's important to assess the presence of suicidal thoughts and the impact of the condition as both. Then they mentioned what Dr. Brian Hu says, that lifetime suicidal ideation and thoughts are very common among people who have RLS, and those thoughts are not dependent on what type of people or the depression. Rather, it's associated with the severity of the condition. It's associated with what is associated with suicidal ideation and attempts seems to be related to how severe the condition is. Then look at the sentence in the start. They have said it's difficult to evaluate the condition and find effective treatments. Okay, all right. Now look at the options. Keeping those in mind, nowhere they have talked about anything about older people. They did not say effects of RLS can be better identified. No, they said, wait a second. They said it's important to assess the effect of RLS and the presence of both. They need to assess. Take a second. I understand it's a bit tricky because they've asked about something that's not directly given here. So take a second. They've said they need to assess two things. What do they need to assess? One is the impact. Second is the
Impact
presence
of RLS.
RLS. That means effect of RLS and the presence of suicidal thoughts. But they never said that the effects of RLS can be better identified. You can better identify, find out better. You can find out the effects better if because of that it's good to treat suicidal thoughts. They did not say that. They said you need to identify suicidal thoughts and you need to identify the effects, both. Not that this will make this better. They did not say that. But see, it's very challenging to evaluate the condition and treat it. So they need to assess the impact as well as the suicidal thoughts. Then Dr. Brian actually has given us why suicidal thoughts is important. Because suicidal thoughts are very common among people with restless leg syndrome. It's not dependent on what type of people, what type of depression, but it's dependent on how severe the condition is. So depending on the severity, people have suicidal thoughts, right? So when you think about like that, among all the options, C becomes the best. Because suicidal ideation, according to Dr. Brian Hu, suicidal ideation is related to the severity of the condition. So if you're able to, if doctors are able to treat it, what happens? It makes managing the condition easier, right? Because RLS suicidal ideation is dependent on. It's okay. I have to say one second. I'll not confuse you. Give me a second. I know some of you might be confused. Give me a second. Dr. Bryan basically says suicidal thoughts are common, okay, and is related to the severity of the condition. That's what Dr. Bryan says. Okay. Then at the start of the paragraph, they also say it is challenging to treat the condition. Okay. Now, take both of these sentences into consideration and tell me, if you take these sentences in isolation and into consideration, among the four, what would be the best option? Only look at these two sentences. C. That's exactly why that is. So this approach of questions it happens in OET, where they say a lot of things in the paragraph and they've talked about the treatment. Only once they've mentioned the treatment. This is a sentence that they've mentioned about the treatment, and this is exactly what the doctor says. Okay, so these are the only places where they've talked about treatment, and this is what the doctor says. So based on what's given there, they've asked a very not so clearly given question. So nowhere doctor has commented on the treatment. He has just said this. So based on that, they are asking us about the treatment. So when you consider these two sentences, C becomes among the three options, C becomes the best. I know this is an indirect one. I know this might be a difficult one. Take a second. Try to go through what I've told you. Again, let me tell you, nowhere Dr. Bryan talks about treatment. So that's why Dr. Bryan suggests it based on his words, they are suggesting this, that he suggests this. Why? So consider these two sentences and look at the options. So which one is the best? C is the best. All of you go through it. Come on. I completely agree. This is a very tricky one. On the day of the exam, I'm not sure whether it will click for you, but I can tell you one thing. Always remember, among the four, the most appropriate. That's what we're choosing. So among the four, A and D, of course, no. B, better identified is nowhere said. They've said the sentence, they need to assess the impact of RLS. They did not say it will be better identified. So when you consider the remaining these two sentences, C becomes the best option. Okay, here better makes it the wrong option. Okay, Atulya, Binsi, Shalini, Dina, Princey, Anshu, Dali, Atra, others. Did I convince you? I know it's a long shot, but were you able to understand what makes C the best option? At least that.
Yes.
So take a second, go through the condition, and remember what I told you. Dr. Koo, he has not directly said anything about the treatment. He has directly commented on suicidal thoughts. Based on that comment, they've asked us about the treatment for what the reason for treating suicidal thoughts. So based on these two sentences, option C is the best. Okay, I'm not sure on the exam day how well you will be able to process it. This is an indirect question, so I want all of you to go through this later based on what I've told you. And if you have any questions, get back to me on that. Okay, all right. So I'm moving on to a third question. Okay, all right. Vinci, can you unmute yourself and read the third one? Yes.
What did the LA team learn from their investigations?
Yale team. Yale is a university in the US. What did the Yale team learn from their investigations? So what do we need to find out? What did the
Yale
team understand? What did they understand from their investigations? From their investigations, what did they understand? Take a second, go through it. From their investigations, what did they understand? What did the team understand from their investigations? Okay, let's go through the next paragraph. All of you go through it. Come on. Okay, so let me read it because it involves a lot of numbers and everything. So let me read it. Until now, RLS and its potential relationship with suicide had not been studied in depth. So writer is saying until now, they have not till now, they have not, they had not studied the relationship between, possible relationship between restless leg syndrome and suicide. Then they say that the Yale team, the Yale University team, investigated the frequency of lifetime suicidal behavior in 198 patients with severe RLS and 164 who are controls. Okay, so let me tell you one thing. So whenever in a study where you have patients who have the condition, then when they say control group are the ones who don't have the condition. Okay, just understand that. Control group are the ones who do not have the conditions. Okay, so basically, usually in a study about a condition, they usually have two groups, the patients and the control group. Control group usually do not have, usually does not have the problem. Okay. All right, so take a second. So they said in the so far they have not done any in-depth study on the connection between suicide and RLS, but the Yale University team, they conducted a study on the frequency, on how often suicidal behavior happens in 198 RLS patients and who had severe RLS, and they also had 164 control people who did not have RLS. Okay, so they investigated the frequency of suicidal behavior for among 198 RLS patients and people who did not have RLS. All participants completed, all the participants, the 198 plus 164 people, they completed the suicidal behavior questionnaire and the brief lifetime depression scale. So they completed suicide behavior questionnaire and depression scale. RLS and controls were similar in age, income and gender. So the people who who had RLS and people who were in control groups, their age was similar. That was average age of 51. Their income was similar and gender was same. Okay, so there were two groups. One group had severe RLS, other group did not have RLS, and both groups they completed a suicidal behavior questionnaire and depression scale, and both groups were of similar age, income and gender. Compared with controls, control means control group, compared with them, patients with RLS were more often white, that is 96% and 88%. 1 second, I'll write that down. Were more often white. That means, people who are of Caucasian origin. Okay, 1 second. 96 is RLS, in 88% is control group. 1 second, let me write that down. Okay, so compared with controls, patients with RLS were more often white and less often had higher education. So they had less often they were not that educated. Patients with RLS did not have higher education. So RLS 84%, 96 is controls, because less often had higher education. So the 84% is for RLS, 96% is for control, and were more often married. So people who had RLS were more often married. So 72% of them were married, and the controls only those were the controls. They were not married. Only 60% of them were married, and were less often employed or retired. Okay, so people who had RLS were less among them. They were not that employed, and they were less often retired. So 80% of RLS people were not employed or retired, but 90% of the control group was, they were employed and retired. Significantly more patients with RLS than controls were at high suicide risk. So significantly, importantly, more patients with RLS, people who had RLS, were at high risk of suicide compared to people who were in the control group. The score was equal, or SBQ, the suicide score was greater than or equal to 7, and had lifetime suicidal thoughts or behavior independent of their depression history. So independent of whether they had depression or not, people who had RLS, they were at high suicide risk and had lifetime suicidal thoughts or behavior. All of you go through it. So there are two groups basically, people who had RLS and the control group. Control group did not have severe RLS, and they both completed questionnaire and depression complexion scale, and they were all of same age, gender, and income. Compared to the control group, RLS people were white, means they were Caucasians, who had who were not brown, or who did not have a brown or black complexion. They were white, basically fair skinned people. Okay, and they also had higher they also people who had RLS were less often had higher education. So they were not they did not possess higher education compared to the control groups, and they were more often married. So people with RLS were married compared to the other group, and they were less often employed or retired. They were not, many of them, I mean 80% of them were not employed or retired. Most importantly, people with more patients with RLS than controls, people who had a RLS compared to controls, were at high risk of suicide, and their suicide score was more than 7 or equal to 7, and had a lifetime of suicidal thoughts or behavior, independent of whether they were depressed or not. Are you guys clear? Without confusing you, have I explained the paragraph? Atulya, Binsi, Jinaz, Anu, Manjusha, Princy, Anju, Dali, Shalini, are you clear? Vinita, are you clear? Jubi, are you clear?
Yes, ma'am.
Okay.
Yes, ma'am.
All right. Okay. Now let's have a look at. We need to figure out what did the team learn. So can you read the options one by one? Vinci, yes.
Some people in the control group had previously suffered from RLS.
Did they say that people from control group
No.
had previously
No.
had? No. Next
No.
one. Next one.
The likelihood of someone developing RLS depends on various factors.
Did they learn that the possibility of people developing RLS depends on various factors?
No, ma'am.
No, they did not say that. They did not focus on the development of the condition. Next one.
Answers to the questionnaire did not provide a lot of useful data about RLS.
Did they say that the answers to the questionnaire did not give them any useful data?
No, ma'am.
No, they got data. They got a lot of data, in fact. Okay, so D can be the answer. D can be the answer based on elimination. So can you read the option?
A person with RLS is more likely to attempt suicide than someone without it.
Right, people with RLS is more likely. That was significantly people with RLS were more their risk of suicide was high. So that's why D is the answer. Pretty straightforward. I'm moving on to the next question. Let me read it. The expression followed through refers to. So one second. Before we look at the sentences, let me say something here. Okay, followed through. Okay, for example, when I say Dina followed through her New Year resolution, and passed her OET exams. What does that mean? Dina followed through her New Year resolution. What does that mean?
None of my New Year
Did she leave it
resolutions.
halfway? Did she forget about her New Year resolution?
No, followed you.
Followed through means she actually she saw it through. She actually went through it. She did not leave it halfway. She saw it through. She completed what she had to do. She saw it through. Dina followed through her New Year resolution. So that means her New Year resolution was to pass her OET exams, and she actually followed it through. She saw it through. She did what she had to do. I'll give you one more example. Lisa followed through with her travel plans. So did Lisa leave her travel plans halfway?
No.
No, she actually completed it. She saw it through. Followed through means saw it through, completed it, did everything, put every effort into it, and completed it, or did what she had to do, basically. Okay, so keeping that in mind, let's have a look at the question. So this is the paragraph where you have followed through. So this is the sentence. Okay, one second. This is a sentence with the vocabulary. Okay, so while one sentence after the vocabulary, one sentence prior to the vocabulary. So all of you read these many sentences from here till here. When you have a vocabulary question, ideally you need to read the sentence with the vocabulary, the sentence above it, the sentence after it. All of you go through it. Go through the 3 sentences. Okay, let me read it. Mood and anxiety disorders are highly comorbid in RLS patients. So mood and anxiety disorder are highly comorbid, coexist in RLS patients. Okay, people who have RLS, they do have, you know, mood and anxiety disorders. It coexist in them. Okay. Noted John W. Winkleman, MD, PhD from Harvard Medical School and Massachusetts General Hospital, Boston. So according to Dr. John W. Winkleman, mood and anxiety disorders are highly comorbid. They coexist. My feeling is that the suicidal ideation, he says, my feeling, I feel that suicidal ideation or even plan or intent, if they plan to or if they intend to commit suicide, and even some who have followed through, is the same thing you see in patients with chronic pain. In many respects, RLS is a chronic pain disorder. All of you go through it. So he says mood and anxiety disorders are highly comorbid, coexist in RLS patients. Then he says that I feel suicidal ideation, suicidal thoughts, or even plan or intend to commit suicide, or even some people who have followed through. What does that mean? What does that follow through mean? Followed through what? What is he talking about?
Suicidal ideation.
Oh, you went through suicidal. So when you went through it, when you follow through it, that means you went through it. That means they have tried to commit suicide. Okay, so he says people who have the suicidation or even plan or even intent or even have followed through it, they did what they have to do. What they have to do here was, their thought was suicidal ideation. So when they do it, they basically committed suicide. It's the same thing. Whatever, all these things that he sees is same as in patients with chronic pain. So therefore, he says that in many aspects, RLS is a chronic pain disorder. Okay, so followed through means carried on with it or went through it. They saw it through. So let's go through the options. Expression followed through refers to RLS patients who have attempted suicide. The expression followed through refers to the relationship between RLS and pain. Do you think B is the answer?
No, B is not answer.
No.
B is not the answer.
No,
Okay.
ma'am.
No. The expression followed through refers to a time when RLS has been resolved.
No.
No. The expression followed through refers to management of RLS by the doctor.
No, ma'am.
So what is the
ma'am.
answer? People who have attempted or followed through with their
patient
suicide have actually followed it through, who has saw it through, who had done what they had to. Their thought was suicidal plans. What plan they had, they saw it through. That means they basically attempted suicide. So A is the answer. Okay, when you follow through something, you saw it through. You do everything you need to do for that particular plan or for that particular thought. Okay, all right. So that's why A is the answer. I'm moving on to the next question.